Okay, so we have a lot of lecture about dementia and Alzheimer's. We're going to go ahead and jump right in with an introduction to that. First of all, it's important to know the normal changes in the brain and the nervous system due to aging. We know that as you age, nerve cells are lost and that nerve conduction slows, which would then make your reflexes slower. There is a decrease in your senses, the vision, hearing, taste, smell, and touch. That all decreases. There's a decreased blood flow to the brain and changes in the sleep pattern. We also know that the memory shortens with forgetfulness, but dementia is not a normal part of aging. So there are certain diseases that affect the brain, and these changes in the brain can affect cognitive function. It's really important to understand what cognitive function is. You need to know this. Cognitive function is memory, thinking, reasoning, ability to understand, judgment, and behavior. Sorry about that. So dementia is the loss of cognitive function that interferes with routine personal, social, and occupational activities. So let's break that down again. Dementia is the loss of cognitive function, memory, thinking, reasoning, ability to understand, judgment, and behavior that interferes with your daily life, right? Your personal, social, and work life. Dementia is not a disease itself or diagnosis itself, but is a group of symptoms that often accompanies a disease or condition. It's not a normal part of aging. It can be temporary or permanent. So when it is temporary, that means the changes in the brain have not occurred, and when the cause is removed, so are the signs and symptoms. So this can also be called pseudo-dementia or reversible dementia. So some examples of pseudo or temporary dementia would be depression, possibly drug reactions. Sometimes anesthesia or pain medicine can cause somebody to have dementia-like symptoms. Metabolic or endocrine issues like diabetes and kidney, liver disease, hearing or vision loss, dehydration, tumors, infections like pneumonia, UTIs, arteriosclerotic changes. Once those things are cured, once the UTI is treated, once the pneumonia goes away, then the confusion or the dementia symptoms go away. Once the depression's treated, then the symptoms go away. So these are all things to think about. Acute confusion, where it comes on suddenly, that is delirium. This is usually temporary and it is considered a medical emergency. It would be caused by an injury or an illness or infection. So you're taking care of Betty, and Betty's always been together or with it. You walk in her room and all of a sudden she seems very confused. She's not making sense. This is something we need to be taking seriously. Get a set of vital signs, report it to the nurse. They need to be looking for UTI and pneumonia would be the first things to look for. Did she fall and hit her head? You know, there's a lot of things that could cause that temporary dementia or delirium, which is a very acute case of confusion. So then when we talk about permanent causes of dementia, that's like Alzheimer's disease or multi-infarct dementia. So that's from multiple strokes and the damage to the brain that happens because of that. Trauma and head injury, brain tumors, and then alcohol-related syndrome. So this slide actually is not correct. I'm going to move on from that. The number one cause of dementia, permanent dementia, is Alzheimer's disease. And the second most common cause of dementia is Lewy body dementia. After that, then you have vascular dementia, which is caused through strokes. So signs of dementia can be short-term memory loss, personality changes, problems with common tasks, trouble finding names for familiar objects. And you see somebody that's struggling in this way, you can certainly start thinking about dementia as an option. If they get lost on their normal routines, I'm not sure why that slide's not coming up. There we go. They lose interest in things they used to enjoy. They have poor judgment or difficulty performing tasks or learning new information. These are all things that we should be watching for. And then to get a diagnosis of dementia, unfortunately, it's not easy. It's not a blood test or brain scan, but they have to rule out all other things. So remember, there's that big long list of stuff that causes temporary dementia. Well, you have to rule all of that out. We're going to check and see what their vitamin level is. We're going to check and see if they have depression. We're going to see if there's heart issues or kidney issues or uncontrolled blood sugars, or all of these different issues have to be ruled out. They take a history, they talk to family, they do scans and blood tests and chest x-rays and all of that. And then the diagnosis comes from exclusion of all these other possible things that could be causing dementia.